So this is the first product that we're going to look at today, is the Toothbrush foam mouth swab. Now, for many years, the pink foam mouth swab was the only mouth swab that was available on the market, and but there were over 800 patient safety incidents that were created around the pink foam mouth swab, and that was due to the fact that the foam head was glued to the stick, and when it was immersed in water and soaked, the head could come detached from the stick and get lodged in patients' throats, as indeed it did, and sadly in some cases residents choked to death. So that created a first issue with foam mouth swabs. The second issue is that if you are working with people who are likely to clamp down on the mouth swab when it's in your mouth, then they can clamp down and take chunks from the foam swab, which again can become lodged in the throat and cause a choking hazardous risk. So as a business, because the pink foam mouth swabs were not considered safe anymore, we discontinued them as a range because we will only promote safe and fit for purpose products. And we searched and researched to find what the safe alternatives are. And we now have 3 alternatives that we're able to offer our customers and people who want to provide really good oral care and support for their people they support. So the first one is actually still a foam mouth swab, but this is called Toothbrush, and it's different and it's much better made than the original pink foam because of the way it is actually bonded to the stick rather than glued. So it's part of the manufacturing process, and it has got really useful ridges all around the swab, which will help to remove secretions and heavy saliva from all around the inside of the mouth. Now, there are 2 schools of thought around using this product. One is that it is still a foam mouth swab, albeit it is a much safer option. But secondly, I do know that there are many end-of-life care nurses that I've spoken to who still really like to have a foam swab risk assessed so that they know it's safe to use, because the fact that it will absorb more fluid to enable them to moisten the mouths of the people and freshen the mouths of the people they support. So, and the other benefit of this particular foam swab is that the handle is so much longer than the original pink foam, so it really does allow you to get to all the areas of your mouth that you need to, the back areas, etc., much more easily. So this is your Toothbrush foam mouth swab. So when we were searching for a safe to use alternative to pink foam, eventually we found a product which was originally known as a Swizzle Stick, and this is now has been rebranded and is known as Mouthies. And this is completely different to the mouth swab, but it can work really well. It's actually made of silicone, so it's got lots of little silicone filaments on there, which you can see. And the idea is that you can swizzle it round the mouth to help, again, collect secretions on the tongue, around the cheeks, the mouth, the top of the mouth and tongue, and around the gums. And this product is actually reusable for up to 12 hours. And what you need to do for single patient use. So this product can be, once it's been used, it can be rinsed under hot water, and then it can be left in one of our handy little stands that we have to dry next to the bed, ready for the next usage. This is a medical device product. It is CE marked. It is safe to use. It's safe to use with a lot of different types of patients, for end of life, people with dementia, people with dysphagia, and it can also be used to apply products like dry mouth gels. It makes it easier to apply those to the hard to reach areas of the mouth. What else can I tell you about the mouth ease? No, I think that's, oh, the only thing that you can't do with this, and this is where our third product comes in, is that it isn't suitable for removing plaque from the teeth. So you cannot brush your teeth with a mouth ease. It's not going to be effective at removing plaque and bacteria from actual teeth. So if that's what you're looking for, we have a brand new 360-degree toothbrush, which can be used to brush teeth and remove plaque from teeth and gums, as well as remove secretions from the tongue and the internal area of the mouth. And again, you can see there that you have got the toothbrush goes all the way around. It's 360 degrees. So again, you can use it in a rolling motion to help around the mouth to collect the secretions. But that can be used as a toothbrush, and so it will have longevity and lifespan. I believe that can be used for up to 3 months. So those are the three of our innovative mouth care products.